Hello, I'm Dr. G with Beginnings Treatment Centers. I'm the Chief Clinical Officer at our facility, and today I've been asked to talk about opiates and some of the aspects of opiates, their classification, their effect on the brain and body, as well as how they feel like. So let's get to that. Very quickly, opiates are a very interesting category, actually. They kind of cross overlap across multiple categories because of their effects. But then generally, let's understand where they come from. So opiates or opioid medication, if you will, they're synthesized from heroin. And heroin is synthesized or produced from morphine. And morphine comes from opium. Opium comes from poppy seeds, if you will, or poppy flower, right? And so that's how the progression goes from more or less a natural product to a synthesized product that can be used in medical setting. And medication that has characteristics of what opium and morphine and heroin generally have, they are called opioids. And so opioids, and then in the whole category being called opiate category, on the one hand is something what we call an analgesic, or more or less a pain reducer. It's because in their medical setting they're used as pain reduction medication. So they're used in hospital settings for surgery, etc., and also acute pain. So, and on the other hand, they can also increase dopamine in the brain, which leads to euphoria. So you could think of it as almost like a stimulant, if you will, or so it kind of stimulates and gives you a elated mood. And at the same time, they can also increase GABA, and that too can lead to a reduction of anxiety. So it could also be regarded as an anxiolytic or anti-anxiety medication. However, the zero-sum effect of all these ups and downs in the brain and body is actually really a depressant zero-sum effect, meaning the body and the brain are put into a depressed state, ultimately to the point that we go to sleep. Anyone using opiates, and perhaps to the point of overusing and overdosing on opiates, they're gonna just go to sleep. And not only their mind goes to sleep, ultimately it can lead to a final sleep of the organs or shutdown of the organs. And that's what really more or less an opiate overdose would lead to death, because the respiratory system simply shuts down, the cardiovascular system shuts down in increased amount, excessive amounts. But then generally, if you want to just stick with one category, we would stick with pain reduction category, or other words, analgesic category. So that's what opiates are. Now, the very specific way that they affect the body is that they impact the opioid receptors in the brain, in the spinal cord, as well as gastrointestinal organs. That's why, as side effects, if you will, not only you will have the reduction of pain and also euphoria and the reduction of anxiety, but also you get, for instance, constipation. You can get a lot more vomiting. You can get stomach cramps and pain. You can get all kinds of different side effects that we don't really have the time to go to, but ultimately the feeling of taking opiates is very important, and that's what most people tend to take them, especially when they're prescribed for chronic pain, despite all those side effects, is that people really are kind of distracted, if you will, from pain, because that's, again, as one of the main effects of opioids, the pain signals are blocked. Even though we have, let's say, an injury or surgery or a wound or some kind of a source of pain, but those signals are blocked and they're not registered anymore. And that's the relief that everybody likes and want to get. So when we are talking about feeling, how does it change our feeling? It's we feel less pain, we feel relaxed, we will feel relieved, we feel a little bit more peaceful, if you will. And also a major, again, main/side effect of it is that we kind of feel sleepy. You know, it puts us to sleep. It takes us down, more or less. It allows us to forget things, to escape more or less the reality around us, the pressure, the anxiety, the stressor around us, because we can check out. And that's another aspect of what we feel. We feel relieved because we can check out, because we can escape those issues and problems around us. We can detach from the problem that is affecting us on a daily basis. And also a good feeling, that euphoric feeling, like things are okay, fantastic, things are good. You don't have to worry about them anymore. Things are going to work out one way or another. Again, a sense of, you know, that's not my problem anymore. I can relax. Even though the problem exists, or the consciousness is there, yeah, the problem is there. I haven't gotten rid of the problem yet, but I don't really need to care about it. So also a sense of like carelessness, if you will, that sets in. I don't have to care about it. The pressure is off from that both kind of internal and external pain. I hope that answers the question. So if you like this video and would like to learn more about other drugs or modalities, therapies, and receive more information, I invite you to subscribe to this channel, as well as make a comment, and check out our other videos in that regard on beginningstreatment.com.